Hi guys, Dr. Armagan again. Trying to answer a few more questions. So one question was, what makes a virus infectious? What does it mean if a virus is contagious? And how do scientists calculate that? What does that mean for us? So an infectious disease is one that's caused by, it could be a bacteria, it can be a virus that get into the body, causes problems. And some, but not all infectious diseases can spread directly from person to a person, one person to another person. Infectious diseases that are spread from person to person are said to be contagious, right? So some infections spread to people from animal or insects, but they're not contagious from another human. For example, Lyme disease, you can't catch it from someone that you're hanging out with or pass it on the street, but it comes from a bite from an insect. Contagious diseases such as the flu or colds or strep throat, they can be spread from person to person contact in several ways, like direct physical contact, or when that microbe travels through the air, like coughing and sneezing. So we have to understand contagious infections. So the spread of an epidemic depends on two things: how many people each case infects and how long it takes for an infection between people to spread. So the first number is, or quantity, is called the reproduction number, and the second number that we care about is called the serial number. The reproduction number is called R0. It's like R with a little zero next to it. And it's a mathematical term that indicates how contagious an infectious disease like a virus or COVID-19 can be. It's referred to the reproduction number. And as an infection spreads, it can spread to new people and reproducing itself. So there are three possibilities. What does this R0 or reproduction number mean? The first is an R0 of less than 1 means that an existing infection can cause less than one new infection. So in this case, the disease is eventually going to die out. If the R0 of each infection equals 1, that means that the disease is going to stay alive, but it's going to be stable. There won't be an outbreak or an epidemic or a pandemic. If the R0 is more than 1, each existing infection causes more than one new infection, and the disease is going to spread between people, and there can be an outbreak or an epidemic. So the R0 of the novel new coronavirus or COVID-19 so far seems to be around 2 to 2.5, according to the World Health Organization. For a comparison, the R0 of measles would be as low as 3.7 or very, very high. And there's reasons for that variation. The R0 of the seasonal influenza is about 1.3. So this means that the coronavirus, COVID-19, is more contagious than the seasonal flu, but less contagious than the measles. So the combination of conditions today, because of advances in medicines, vaccines, means many diseases that were deadly in the past can now be contained and sometimes cured. For example, in 1918, there was a worldwide outbreak of swine flu that killed 50 million people. And the R0 value of that in 1918, swine flu, was between 1.4 and 2.8. But again, the existence of vaccines and antiviral drugs make viruses much less deadly now. Okay, so some diseases are contagious for longer periods than others. For example, according to the Centers for Disease Control and Prevention, adults with the flu are typically contagious up to 8 days, while children can be contagious up to 2 weeks. So the longer the infectious period of a disease is, the more likely an infected person is likely to spread the disease to other people. And of course, a long period of infectability contributes to that R0 value. If a person who's infected with a contagious disease comes into contact with many people who aren't infected or vaccinated, the disease will spread more quickly. Like if they're in a very heavily populated area, and that's also going to contribute to the higher R naught value. And what about modes of transmission? So the diseases that spread most quickly and easily are the ones that can travel through the air, such as the flu or measles. Physical contact with an infected person isn't necessary for the transmission of such conditions. You can catch the flu from breathing near someone who has the flu, even if you never touch them. In contrast, diseases that are transmitted through bodily fluids, such as Ebola or HIV, aren't as easy to catch or spread. This is because you need to come into contact with infected blood, saliva, or other bodily fluids to contract them. So airborne illnesses tend to have a higher R naught value than those spread through contact.